Hi, my name is Sloan Cape. I'm doing my project on ectodermal dysplasia. So ectodermal dysplasia, otherwise known as ED, they're disorders that affect the skin, sweat glands, hair, teeth, and nails. Some individuals with ectodermal dysplasia may also have a cleft lip or palate and/or palate. Ectodermal dysplasias occur when the outer layer of tissue, so the ectoderm of the embryo, does not develop normally as it should. If two or more body structures derived from the ectoderm are affected, a person is considered to have ectodermal dysplasia. So, what causes ectodermal dysplasia? Um, Ectodermal dysplasias are caused by a change or mutation in a gene. ED can be passed on from parents, or it can just occur when there's no family history of the condition. If it does occur and there is no family history of this condition, parents should know that they didn't do anything to cause this gene mutation that is present in their child. Sometimes it can just happen. It's a rare disease. In the US, there's fewer than 200,000 people that have it. Um, X-linked ectodermal dysplasia, that's more related to the oral cavity, because there's many different categories of ectodermal dysplasia, but the most common form is called X-linked ectodermal dysplasia. It affects boys more than girls because, or severity, I guess, is more affected in boys because with this X-linked ED, boys usually have several missing teeth and conical shaped front teeth. And girls with X-linked ED have milder and more variable symptoms. They also might have missing and abnormally shaped teeth, just not as common as it is in boys. How does ectodermal dysplasia affect the oral cavity? So there are a bunch of different symptoms that one might have if they have ectodermal dysplasia. It could make it thinner or softer than average tooth enamel, which can lead to cavities, tooth decay. It could have a person have missing teeth, pointed or globe-shaped teeth, smaller than normal looking teeth, or teeth that are widely spaced out. It just depends. You could have all of those symptoms or just one or two. Have an abnormally positioned teeth and jaw. They can have reduced saliva, leading to dry mouth, which also can cause cavities. And they could have cleft lip and or palate. Um, that affects the oral cavity if they have ectodermal dysplasia. Here are some examples of ectodermal dysplasia. These are examples of the pointed teeth, cleft palate, and spaces between the teeth that are common to see in these patients. On the left, you can see there's pointed teeth. The teeth are spaced out more than they should be. Everything's kind of abnormally positioned. You can see that the gums, the gingiva are very bulbous. And in the middle here, you can see the cleft palate that might have been affected by that, by ectodermal dysplasia. And on the right, this just shows a radiograph and a clinical picture of ectodermal dysplasia. Again, the teeth are pointed, they're very spaced out, and you can see in the x-ray, the teeth that are coming in will also be pointed and abnormally shaped. The diagnosis of ectodermal dysplasia is usually suspected by a dentist. If they suspect this by looking at their teeth clinically, with the pointed or the globe shape, smaller than normal teeth, or anything's abnormally positioned, um, or if they, have a high risk of cavities, they might suspect this. And if they do, the dentist can take radiographs, and if they do suggest that they have ectodermal dysplasia, they'll refer them to a doctor that has experience with diagnosing ectodermal dysplasia to confirm that. It's really important to have the correct medical professional diagnose this condition in order to make a correct and good treatment plan, so that you can correct this issue. So treatment of ectodermal dysplasia for children, it's kind of depends on the person's age because most surgeries can't be completed until, the face, head, jaw are finished growing. So for younger children, dentures and partials are an option. And, as the child's mouth grows and permanent teeth erupt, recommendations for other types of treatment may be made, such as the need for, braces to correct the position of the teeth and to assure their proper function, because the whole goal when treating ectodermal dysplasia is to have that function of the teeth restored as soon as they can, as young as they're able to. Again, treatment depends because most surgeries you can't complete until the jaw and face are finished growing, but it's really important to have that function restored as young as they can. For adults and older children, crowns and veneers are an option to fix this ectodermal dysplasia, and more permanent solutions are recommended for adults with this condition, including fixed tooth restorations like dental implants. Oral surgery may also be recommended to improve the shape of the dental arches and correct related issues within the mouth. So, as they get older, oral surgery may also be recommended. It's just that when they're younger, it's kind of harder to do, big surgeries like that because they're not finished growing. The treatment possibilities are that a prosthetic rehabilitation in patients with ectodermal dysplasia requires an accurate and personalized treatment plan. It's really important that every single patient has a different treatment plan or that suits them because, again, and it's the same thing in dental hygiene or with any medical field, not every patient is the same. So with something like this, especially, they have to have a personalized treatment plan. You can't just go in and say, oh yeah, let's just put an implant there because that's might not work for some people. Because, some treatment may include the removable, fixed, or implant supported prosthesis. So some people might not be able to have implant supported. They might just have to have a removable prosthesis. And it all depends on the severity of what's happening in their oral cavity. So like in their mouth. So it all depends on the patient. Computer-guided surgery may benefit dental implant rehabilitation of patients with ectodermal dysplasia because this can avoid the risk of complication and injury of anatomical structures. Again, really important to have an accurate and personalized treatment plan when treating ectodermal dysplasia or any disease for that matter. So here's a treatment example. This is from a doctor of the Department of Prosthodontics and Department of Orthodontics. On this picture, just a before and after. This patient, there's a before in the picture labeled A, the affected girl right here. It shows the before the dental treatment and everything. Again, you can see the spacing, you can see the pointed teeth. And then in the picture labeled B, this is the results of the prosthodontic rehabilitation. So you can see that the prosthesis right there. And this is really important for, especially with children, to improve their self-esteem. So this is just a treatment example of a before and after of how you can treat ED. And then here is another treatment example. So this is oral rehabilitation in a woman, in a 10-year-old girl with ectodermal dysplasia. So in A, there's just the profile view. In the picture labeled B, this is the intraoral view. And C, and then D is the panoramic image, as you can see. And then in the picture labeled C, this is kind of the after. This is the results of the prosthodontic rehabilitation. So this is the maxillary mandibular removable partial dentures in place, as you can see there. And going back to both treatment images here, just to show you again. So this one is, I'm sorry, in the beginning, in the A picture, she's missing 14 teeth, and then you can see, they put that prosthesis there to no longer show those missing teeth. And the same in this treatment example, they added that removable partial denture. It's just really important with the treatment of ectodermal dysplasia because it's contributed to increased self-esteem of children and adolescents and even adults with ectodermal dysplasia. So I'm just going to show you one more time here. Here's the before and afters. So in conclusion, ectodermal dysplasias are caused by a change or mutation in a gene. Ectodermal dysplasia can be passed on from parents or can occur when there's no family history of the condition. So again, it's not guaranteed if it's a genetic thing, and it's also not guaranteed that a child is not going to get it because it's not in their family. A child can have ED whether their parents have it or not. It's usually suspected by a dentist. Again, they will take radiographs and see it clinically, and then if they suspect it, then they will refer them out to a medical professional who has seen this a lot and can diagnose it for sure. The whole goal when treating ectodermal dysplasia is to have the function of the teeth restored as young as possible. Again, that's really important to have that function of the teeth restored. As the child's mouth grows and permanent teeth erupt, recommendations for other types of treatment may be made, such as the need for braces to correct the position of the teeth and assure their proper function. Treatment may include removable, fixed, or implant-supported prosthesis, again, according to the severity of dental manifestations. And then just in this picture over here, there's the before and after. So A and B, that's the before and after to see on a radiograph. You can see in B that they added those implants there on the mandibular arch. In C and D, you can see how that is affected clinically. So you can see that there's an implant-supported denture there on the mandibular, and there's the removable partial denture on the maxillary. So there's just another example of a treatment there, and that's from the Faculty of Dentistry from the University of Sydney, Australia. And here are my references for this project. Thank you so much for listening, and I hope you know more about ectodermal dysplasias now.